Good doctors and bad doctors. What's the difference? Let's talk about it. Hi, my name is Jeffrey Butts and I'm a doctor of dental surgery. And this channel is all about health and wellness for you to be healthy and wealthy, all right? And today, we're talking about good doctors. Now, I would like to be a good doctor. I would like to be a good doctor. I hope that I am presently walking around in this skin right now as a good doctor, right? I think a good doctor genuinely cares about their patients. I think that they go beyond. I think they get to know their patients. I think they take time to see what's going on so that they do whatever they need to do. Certainly for me, whatever I need to do, I just need to make sure that I'm doing it safely and I'm getting the patient in and out in a reasonably good amount of time so that they can live their lives and go on and do some things, all right? So I've heard bad doctor stories, right? Bad doctor stories are doctors that don't listen to their patients, doctors that don't even speak to them, really. They just come in, what are we doing, and they just do it. Now, if the patient is unconscious, I guess that's one thing, because why would you speak to someone that's unconscious? But if they're conscious and they're looking at you walk in the room, doctor, would you please say hello? Would you please say what's up, how you doing? My name is Dr. So-and-so. And Dr. So-and-so, hi, how you doing, welcome, right? So, I'm a doctor of dental surgery, so my area is expert in dentistry. The teeth are not disconnected from the body in any way, shape, or form. So that means that I have to know whom I am serving, whom I'm giving medicine to. What am I going to do for them? How can I make it better? And then sometimes I'm like, how did we get here? What is going on? Wait a minute. Are you not flossing? Those things. So, I mean, if I could quick PSA, please floss twice a day before you go to sleep, before you leave the house. That's floss and then brush twice a day before you go to sleep, before you leave the house. That's a PSA. Would that necessarily make me a good doctor? I don't know. But okay, let's give you some things. I found oral cancer in maybe 3 or 4 of my patients, I think just last year, and that's out of the 5,000 patients that I saw last year, right? When I found cancer, I hope this was a good doctor thing, but this is what I did, okay? I said, you know, I see something that's weird. It's on the back of your throat, it's on your neck, it's in your mouth some kind of way, on your tongue. Usually it's on the back of the throat, close to the tongue, or the back of the tongue. I see this thing that is now normal. It's not what it's supposed to look like. Instead of saying, my God, you've got cancer. No, because how do I know that? You could have burnt yourself, and now I said that you got cancer, and we're gonna go check it out. We gotta send you to a specialist to cut it out, and I've said that you have cancer. And then the specialist sees you, and then, oh, you don't have cancer. So now I have stressed you out, and I just did a video about stress, how stress can actually increase a possibility of your not being well, because stress can do that. But that's in the video, I talked all about that. But what I'm saying is when I see these anomalies, these things that don't look normal, and I am looking at cancer, and I may think that it's cancer. You'll never know that from me. I'll say something like, you know, I see something, it looks weird. I don't know exactly what it is, but I do want to know exactly what it is. So I'm going to send you to the specialist because I'm just doing my job. And scene. That's it. Now, the person doesn't say, I have cancer. No. They say, I got something going on and I got to go check it out because honestly, I just looked at it. I don't know what it is. But I do know that it's something that needs more investigation, so that's what we're going to do. We're going to find out exactly what that is, because if it is cancer, well, we caught it. And if it's not cancer, well, it wasn't cancer, ha, right? Now, I've heard other doctors, they are doctors for years and years and years, and it's like, they'll see something, and they'll say like, oh, well, that could be cancer. Without any testing, without any real knowing, You have now increased the stress of your patient, because I am so sure that nobody wants to hear that they have cancer or cancer is going on in them in some kind of way. And it's not cancer. What? No. So, what makes a good doctor is someone that makes sure that they don't stress you out any more than you need to be stressed out. Okay, now I'm a dentist, so who wants to go to the dentist? Seriously. Nobody wants to go to the dentist. You only go to the dentist for two reasons: pain or vanity. That's it. Otherwise, the dentist could kick rocks. What? Vanity isn't necessarily that you are being vain and you like, look at me, look at me. You're being vain in that you are taking care of your health. And you would like, when you smile, that people say, oh, what a beautiful smile. What a nice smile. That's what you want to hear. So, pain, you know that. Get this, stop this pain, stop this. Vanity, you want to look good, you want to feel good. And like, there's this old skit with Billy Crystal, right? He's like, I'd rather look good than feel good, my darling. That's what he said, okay? But I want you to look and feel good. So you go to the dentist, you go to your doctor on a regular basis to make sure that your body, the body, right, the engine that's driving the soul around, is healthy. All right? All right, so doctors, or what you want to find in your doctor. So doctors, if you're listening, great. And those who go to your doctor, this is what you want to find in your doctor. Do they look you in the eye? Or do they feel like someone you can trust? Do they look healthy? That's an important question to me. If my doctor looks unhealthy, then I would be less apt to do what they say. Because how can you tell me anything and you yourself are not healthy? What are we doing? Where are we going here? Okay? Make sure that you're protecting yourself at all times like it's a boxing match, okay? Because you are the only responsible party for your health. It's just you. It's nobody else. And if you're going to be responsible for your health and you're going to take the reins with both hands, good job, and do what you need to do. Eat right, sleep right, exercise, have detoxification moments, and great mindfulness behavior. Your good doctor is going to make sure that he's reviewing those things with you. How's it going? Did you get a good night rest last night? Are they taking your baseline blood pressure? We do that here at my office because I want to know how you're doing. Heart attacks are the #1 killer in the world, #1. So high blood pressure is simply an indicator that there's something going on, possibly something going on with your heart, and it needs to be something that's addressed. Now, the mind can change a lot of things. So you could be stressed and your blood pressure goes up. You can be. But you know how you can make yourself sick? You could also make yourself well. Let me give you a little quick example, all right? Quick example, all right? Picture a lemon. Cut the lemon, you got a knife, you got a cutting board. It's a nice, fresh, ripe, all the way organic lemon. You put it on the cutting board, you have a nice knife, you cut it in half, and then you cut that half in half. And then you pick up the lemon wedge and you put it in between your teeth and you take a big, big bite and you suck all the juices out, okay? Now, if you're listening to my voice and you're hearing this and you envision that, it's possible that you had a little saliva, extra saliva, get into your mouth. It did get into my mouth just now, but I was talking about it, I was feeling it, I was being about it. But were you? I don't know. But if you were, and you did get a little saliva in your mouth, well, the point that I'm trying to make is that your mind has created that reaction in your mouth. And that reaction in your mouth does not start with the saliva. It starts with all these other factors that have to happen before the saliva gets expressed into your mouth and seen. So now, what I'm saying is that your mind controls how you feel, or you control how you feel. Your good doctor is going to know this information. So he's not going to put anything in your mind that could make you feel in a bad way. If you come to a doctor and you're feeling well, not feeling well, the best doctors, they may not even do anything, but the one thing that they've let you know is that they care, and they have conveyed some sort of confidence for you to be confident with them that whatever is about to happen next is going to be better than the moment that you're in, which is a sick moment. That would be a good doctor, I think. Now, the doctor may not have done anything. The doctor may be prescribed just some antibiotics and he makes you feel good. He could have told you a joke and it made you laugh and you weren't laughing all week because you weren't feeling good. Good doctor, good. All right, now, me, myself, I'm not an antibiotic person, but yes, I give out antibiotics for the procedures that I do because it goes with the procedure and is part of my standard of care based on the American Dental Board of Dentistry. I'm doing the right job, okay? But there's alternatives. There's other things that you can do other than an antibiotic that is more natural, that has less or zero side effects, that you can take, that are all natural, that will help you just like an antibiotic. Can you believe that? That vitamins and minerals and spices and organic foods and vegetables can do things like drugs do. Do you like drugs? I don't know why that always comes out of me. I don't know why. But anyway, guys, look, you're a good doctor, you're gonna feel that that's a good doctor. You're a bad doctor, more than likely you're gonna feel like he's a bad doctor. So use your instinct to judge your doctor. And if your doctor comes off well and he's doing things that it seems like jive with what you believe, stick with that doctor and you can listen to his recommendations. But remember, your doctor doesn't heal you, you heal you. So take care of yourself, keep loving each other, and please, 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 like and subscribe to this channel, okay? Please, 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 check the thumbs up button, okay? Check that button. Please, 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 will you please send this or any one of my multiple videos to anyone that you love. Good friend, loved one, ex-loved one. Send it to a friend and share with them something that hopefully you learned today. Hopefully you learned something in one of my other videos. Hopefully you continue to learn. Scour the internet. Look and see where I am agreed with by other experts. Look and see where people disagree with me. Like and comment below. And thank you so much for listening. We'll talk about some other things later.